Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and developer of the Addiction-Free Pain Management System. Welcome back to part 2 of my All About Pain series. I'm very excited to be offering this series to you, and also want to let you know that in the next few weeks I'm working on a plan where I'll be able to interact at a bigger level than ever before and to help people stop suffering with their pain now. So stay tuned for more information about this as the weeks go by. Today I want to talk about the 5 different types of pain to expand on my premise from the last session that in order to achieve positive and effective chronic pain management, people need to know as much as they can about their problem and what it takes to get in the solution. For example, today I want to talk about 5 different aspects, and if you want to learn more in depth about this and you're watching this on YouTube, please go to the link below to my professional blog where I go more in depth about these 5 areas. The first area is really helping people differentiate between acute and chronic pain and why they need to be treated differently. And basically the premise here is pain is a signal that tells us something's wrong. And to put it really simply, sometimes chronic pain is when that signal gets turned on and it can't get turned off. Then the second part is talking about recurrent acute pain that is sometimes called pain flare-ups or rebound pain. In this type of pain, a lot of people make tragic mistakes by dealing with it by taking extra doses of their pain medication and then they run out. There's a better way. We'll get more about that, and when we move to part 3, we'll be talking more about the solutions for this. The next part, number 3, is neuropathic pain. Neuropathic pain is basically when the pain system gets compromised. They call it remodeling. The research on neuroplasticity talks a lot about this phenomenon where the pain system gets broke. That's the bad news. The good news is it can get fixed. Then we want to talk about anticipatory pain. And the premise here is you get what you expect. So many people with chronic pain develop an anticipatory reaction. They are constantly in fear about doing too much or doing the wrong things because they'll be flared up. And this leads to a lot of people becoming very sedentary and isolative, and that's not a good thing. And then the last part is the opioid-induced hyperalgesic effect. Well, there's a lot of research on this. Please go to my blog post to learn more about this phenomenon. But basically, to put it really simply, it's when you become hypersensitive to pain signals. You know, ordinarily, let's say it takes about 10 pounds of pressure to turn the pain signal on so it goes up to the brain. When people are really into this hyperalgesic effect, it might now take only 1 pound to get that signal going. You become hypersensitive. So it's really important to learn as much about pain as possible, and if you're working with people with chronic pain, educating them is really, really an important thing to do. I believe that freedom from suffering is everyone's right. I also believe it's a responsibility. So stay tuned and please come back for more about my All About Pain so you can help people stop suffering with their pain now. Thank you.